Good evening, everyone. Welcome to our MRL Diagnosis and Treat Research Problems webinar. In today's webinar, our presenter will be Dawit Tesfaye, a C2 medical student at St. Paul Hospital Medical College. He'll be presenting his thesis proposal with his colleagues on assessing suicidal ideation and attempts in female sexual violence survivors from at Addis Ababa's One-Stop Center. And we have, as an external reviewer, Dr. Azeb Asamino. She is an assistant professor of psychiatry at Addis Ababa University College of Health Science in the Zewditu Memorial Hospital. And for the internal review, I'll be doing the review. And I am Tigist Ordina, the founder and general manager of Medical Research Lounge. So Dawit will start presenting. Dawit, you can share your slide and you can start presenting. Dawit will present his proposal in 10 minutes, and we will hear from Dr. Azeb comments, and I'll proceed. And the remaining time will be dedicated for the audience to ask questions. And you can also type your questions in the chat box in the meantime, and we'll get to it at the end of the presentation. Thank you. Over to you, Dawit.
Okay, greetings, everyone. Can you hear me?
Yes, Dawit.
Okay. Hello, everyone. My name is Dawit Tesfaye. I am a C2 medical student at St. Paul's Hospital Medical College. I am really honored to be presenting my research proposal on assessing suicidal ideation and attempts in female sexual violence survivors from Addis Ababa's One-Stop Center. So this is going to be the content of the presentation. It's going to include introduction, rationale, objective, and methodology of the research. So when we come to the introduction, sexual violence is any harmful or unwanted sexual act directed against a person's sexuality without their consent by any individuals, regardless of their relationship to the victim. Suicidal ideation is the thought process of having ideations or ruminations about the possibility of completing suicide. Suicidal attempt is an act in which an individual tries to kill themselves but survives. When we come to the rationale, a study done on mental health issues of sexual violence survivors during war times suggests that 15.8% of the survivors attempted suicide after 6 months after the sexual violence. And also, no data is available on suicide ideation and attempts among female sexual violence survivors in Ethiopia. As you all know, suicide is the only mental health issue that cannot be reversed. So evidence-based knowledge of the prevalence and factors associated with it will be really important in creating new interventions, policies, and strategies to support and prevent suicide. When we come to the objective, the general objective is to investigate the prevalence of suicidal ideations and attempts and associated factors among female sexual violence survivors as accessing one-stop centers in Addis Ababa. We have 3 specific objectives. The first is to explore the prevalence of suicide ideation and attempts in female sexual violence survivors. The second is to identify risk factors for suicidal ideation and attempts in female sexual violence survivors. The second is to identify the protective factor. So when we come to the methodology, the study design and setting, the research will be conducted in all 4 one-stop centers located in Dagmai Millic Hospital, Gandhi Hospital, Turnesh Beijing Hospital, and Abesh Govana Healthcare Center in Addis Ababa, Ethiopia. And the study period will be from August 19th to September 22, 2024. And the study design will be a cross-sectional quantitative study design will be used for this research. When we come to the sample size will be calculated by Cochrane formula with 5% error level and 95% confidence coefficient. By using this formula, the sample size will be 384. And for the sampling technique, random sampling technique will be used. When we come to the population, the source population will be all female sexual violence survivors in the 4 one-stop centers in Addis Ababa, Ethiopia. The study population will include female sexual violence survivors in Addis Ababa, Ethiopia, who meet the inclusion criteria. The inclusion criteria will be discussed later. The study unit will be each female sexual violence survivor who participates in the research. And the sampling frame or unit will be one-stop centers in Addis Ababa, Ethiopia. These centers serve as a hub for sexual violence survivors, and it provides many kind of like treatments, both physical and mental health issues for both physical and mental health issues. And these centers also provide a convenient way to access potential participants for the research. When we come to the eligibility criteria, the inclusion criteria will be female sexual violence survivors. Participants will be aged from 18 to 65 years. Participants fluent in any of the following three languages, being Amharic, Afan Oromo, or English, can participate in this study. Participants will also have to be willing to talk about sexual violence and suicidal ideation. The exclusion criteria will be participants with a history of mental health conditions that can hinder their ability to participate in the study effectively. So when we come to the variables, the outcome variable, we have two outcome variable. The primary outcome variable is suicidal ideation, and the secondary outcome variable is suicidal attempt. And the independent variables will be the age of the participant, the severity of the assault, post-traumatic stress disease, depression, coping mechanism, be it positive or negative coping mechanism, their social support from their family, their friends and significant other, and access to mental health care. The operational definition, suicidal ideation is thought or fantasies related to self-harm or suicide. Suicidal attempt is any self-inflicted act with the intent to die or regardless of the lethality. Female sexual violence survivors are female participants aged from 18 to 65 years who have experienced sexual violence, including rape, attempted rape, or sexual assault, and seek services at one-stop centers in Addis Ababa. So when we come to the data collection, we will be using two questionnaires. One questionnaire will be filled by the researchers, and the other questionnaire will be filled by the participants. The questionnaire filled by the researchers is because we want to assess the severity of the sexual violence, but we don't want to burden them with reliving the experience. So with the patient's written consent, one-stop center records of their visit will be reviewed to know the assault characteristic. This will be used by using a separate questionnaire called assault characteristics by sexual experience survey. Then the questionnaire filled by the participants will receive structured international standard questionnaires in the language of their choice, being Amharic, Afan Oromo, or English, to assess all the dependent and independent variables. The questionnaire will be filled out by themselves in the presence of a consulting physician of the one-stop center or by the consulting physician themselves if the patient cannot read or write. The other depression will be assessed by the questionnaire. The patient has a questionnaire. PTSD will be assessed by PTSD diagnostic scale questionnaire. Coping mechanism will be assessed by the questionnaire, coping inventory questionnaire. And social support will be assessed by multidimensional scale of perceived social support questionnaire. And to assess access to mental health care, participants will be asked about their use of mental health services, frequency of visit or reason for seeking or avoiding care. Then the dependent variables, suicidal ideation and suicidal attempt. The serious suicidal ideation will be assessed by asking participants if they had ever seriously thought about killing themselves. Suicidal attempt will be assessed by asking participants if they have ever tried to kill themselves. When you come to data management plan, to prevent any kind of data loss, photo of the questionnaire will be stored on a hard disk and Google Drive every week. Personally identifiable information will be removed to protect participants' privacy. The statistical software, SPSS, will be used for data analysis. Data will be retained for a period of 5 years after the study completion. After that, both hard copy and the digital files will be securely deleted. To assure quality, short training will be given to the data collectors about the data collection tools. Standardized questionnaires will be used to maintain consistency, and there will be a detailed documentation of all the steps to ensure reproducibility of the analysis. When we come to the data analysis plan, analysis will be made in 2 stages. Firstly, percentage frequency distribution will be used to determine the prevalence of suicidal ideation in attempts. Secondly, logistic regression analysis will be utilized to examine the impact of various variables on suicidal ideation in attempt. The last when we come to ethical consideration, ethical clearance will be obtained from St. Paul Hospital Medical College, and the support letter will also be obtained from the psychiatry department of St. Paul's Hospital. While conducting the research, before receiving the questionnaire, each participant will sign a written consent. The participants will also be told that the participation is voluntary and that they can withdraw at any time. Confidentiality of the participants will be ensured during data reporting and storage by using pseudonyms. This is the reference I used for this presentation. Thank you.
Thank you very much, Dawit. We can start with Dr. Azeb. Dr. Azeb.
Okay, thank you, everyone. Thank you, Dr. Addis, for inviting me to this session. First, I would like to appreciate the students for choosing this topic, which is a very important topic, which is not yet much explored. And I enjoyed reading your proposal. My first question is, I hope that we can go back and forth because some of the questions I need clarification on. So my first question is, in your proposal, you only mentioned team members or medical students. Do you have any other people who are experts in mental health or in gender or social work in your team? Maybe as advisors or as collaborators?
Can I answer?
Yeah, please.
Okay, we have a doctor on board called Dawit Tasfa Georgis, and we'll also be collaborating with an NGO called In Gender Health. They mainly focus on SRHR issues. Those are our two collaborators.
Okay, and the physician, what's his expertise on?
He's a medical doctor. He's not an expert on this issue.
Okay, so one of the things that we first look at when we look at proposals is the team composition. So based on the area that you want to explore, you want to make sure that you have the right expertise within your team. So I would recommend that you involve people who are mental health practitioners in your team. So you already have someone working or people working in gender health, that's good. But it's also important to put them also as to put at least one person as part of your team who's an expert in sexual and gender issues. So this is based on your topic and the thing that you're exploring. So these people will give you on the ground information about practical issues for your research. So the topic I think is very relevant, and I think it's going to help community advocacy. And I think you clearly put that in your research, in your proposal. In your literature review, I hope that you can include relevant researches which are published by professionals in the field in our country regarding suicidal ideation and attempts, the prevalence and its relation with sexual and gender violence. So coming to your methodology, so in your proposal that you sent, you said that you chose Addis Ababa because of economic reasons. What do you mean by that? Can you explain?
It's mainly due to a convenience reason. I live in Addis Ababa. That's mainly the reason I chose it. And also I'm a student, so I cannot travel to other places at this very own stage. That's why.
Okay, I think you have you may have other reasons you might want to explore more scientific reasons rather than just convenience. We know that Addis Ababa is a location for the most one-stop centers in the country. So at least here you have mentioned, I believe, 4 centers. There are some others that are missing that I know, but at least the majority of one-stop centers are found in Addis. And Addis is also the referral center for many complications that people may have due to sexual and sexual abuse. So those kind of reasons may be more relevant than just saying, because I live in Addis, or because I can't travel, I'm only looking at this. Similarly, for the study period, you say that also for similar reasons, it seems the new proposal, but the study period should be chosen, should also be guided by the samples that you want to, that you have calculated and how long it will take you to achieve those samples. In the sample calculation, so you calculated 384 possible samples from the 4 centers. So have you had like a preliminary assessment of the sites and how many sexual violence survivors go to those one-stop centers? Do you have any understanding of the number in each center?
At this moment, we visited only one-stop center in Afrinjober Healthcare Center, and but at this moment we are going to do a pre-test in the next 2 weeks, and we will determine the amount of patients that are going to come at the one-stop centers. But at this moment, we only visited one-stop center.
Okay. I think pre-test is something else. Pre-test is when you want to test whether your questionnaire that you developed or that toolkit that you've chosen will be well understood by the study participants, and if you want to make modifications. But you need to understand how many patients actually use the service. So for example, I don't know the exact number, but for example, if there's only 10 patients that are seeking help every month at each center, then you're not going to achieve your sample size. So that's going to cause some problems, right? So it's good to understand how many patients come to those clinics, and then you can estimate how many of them may give you informed consent, also fulfill your eligibility criteria. So I would suggest that you go to the centers or even contact your collaborators at Engender Health to understand the load of patients at each center. And also it's good to proportionally identify how many patients you're looking for at each center. So you said you used stratified random sampling, but you stratified it, I believe, based on age group. That's, I think at first you have to identify how many patients you want to take from each center, and that's going to also depend on how many patients they take care of each month or each year at those centers. Regarding the inclusion and the exclusion criteria, so in your inclusion criteria in your the submitted proposal, you mentioned the age group of 15 to 65. But I see here that you put 18 to 65. So have you decided which age group you want to address?
This will be the final age group from 18 to 65. We excluded 15 because we have to also consult the parents when we are collecting this kind of data from teenagers. I think that's also going to complicate a lot of things. That's why we excluded 15 years old.
Okay, I mean, this is also something that I think should depend on the type of patients and the number of patients that come to each clinic. So if the majority of the patients that seek care at those clinics is actually the age group of 15 to 18, then you're going to miss a lot of people based on the eligibility criteria that you mentioned here. And even if, as you said, it will complicate things regarding the informed consent process, and I'm glad you're thinking about that, because you'll have to take consent from guardians or parents if they are minors. I think this decision should actually depend on the population that which population or which age group is actually the one seeking care at those ones centers. So I think on the next slide you defined what you meant by sexual violence survivors in your operational definition. So you said this would include rape, attempted rape, or sexual assault. Rape and attempted rape are very specific things, and they're easy to understand. But what do you mean by sexual assault?
Sexual violence is also a term that includes many things. I included it because it was under sexual violence.
But what do you mean by sexual assault?
We didn't really define that at this moment.
Yeah, so the reason we add operational definitions is so that everyone can understand what you mean by each term. So that, as you said, there is a lot of types of sexual violence. So it has to be clear which kind of sexual violence you're including for this research and the reason why you excluded the others, right? So also with regards to this, so there are, so we know that in one-stop centers, people come usually within a few hours or within a few days, the sexual violence or the sexual assault that happened to them. So are you going to interview this women immediately at the time of their presentation at the one-stop center?
We haven't also decided on the duration of the sexual assault that we are going to include, but you are right. We are going to include a specific duration for the sexual assault, the ones we're going to interview.
Okay, this has to be well thought of because immediately after the sexual assault, within a few hours or within a few days, I mean, people are going to be, it's going to be really difficult for people to stay in for this kind of research, to be interviewed for a long period of time. They're already going to be interviewed by different people. I don't know if you know the process in one-stop centers. There are several people who are going to interview them at those clinics. So you're going to be asking them to be interviewed again in detail. Not even interviewed, but you're going to give them questionnaires to fill on their own when they're not in a good emotional state. So it might be difficult to include people at that time. Another thing you might think of to circumvent this issue is to, if there is anyone coming for a follow-up visit, maybe include those or take the addresses of the individuals and try to contact them if they're willing. If that's the case, you'll have to prepare a sort of a phone script that's easy for people to understand why you're calling so that they won't be shocked when you call them. And also appoint them at a different time. So you may have to cover their transportation if you're going to call them for the research purpose. So you'll have to consider the timing of the interview in relation to their presentation to the one-stop clinic. This is going to be, I think, the most difficult decision you'll have to make regarding this research, speaking ethically. And regarding the informed consent process, I think it's good that you have mentioned the main things that are needed to be included in the informed consent process. You haven't attached the informed consent sheets in the proposal that you sent. which is something you need to do. So you say that you're going to use Amharic, Afan, Oromo, and English. So you have to attach all the information sheets and consent forms with each language. And in the information sheet, you will have to include the benefits as well as the risks of the study. So have you identified any risks of the study?
We haven't at this very right moment.
Okay, so you'll have to consider risks of the study. I think one of the things you mentioned, so if the people are distressed, they can discontinue the interview. But you'll have to think that it's not going to be easy for people to discuss their traumatic experiences. They might be experiencing the traumatic events right in front of you. They may be emotionally disturbed. They may also tell you that they have suicidal ideation and have plans to commit suicide in the near future. So you'll have to have a plan for each of those scenarios. This is a very highly vulnerable group that you're going to be speaking to. So you'll have to have safeguarding measures that are ready and available. If these scenarios happen, the easiest thing to do is to link them to mental health professional, but the linking process has to be very clear and very easy to access for this group of people. In order to reduce the possibility of this event happening, in order to respond with that, it's important. This is why it's important to have a mental health professional in your team, and also have a mental health professional member during the interviews who can intervene if there is a severe emotional distress that happens during the interviews. Going to the tools that you used for the study, that you plan to use for the study. Let me go back. Sorry for the exclusion criteria I missed on that. Let's go to the exclusion criteria. So in the exclusion criteria, you said that participants with a history of mental health condition that can hinder their ability to participate effectively would be excluded. But on your literature review, you mentioned, also on your tools that you mentioned, you're considering that people may have depression, may have PTSD, may have previous trauma that may affect their current situation. And we also know that trauma can make people go through different emotional experiences. So I think it's against your own research to exclude people with mental health conditions. The second part of that exclusion criteria says that can hinder their ability to participate effectively, but that can happen whether there is a mental health condition or not, right? People may have cognitive problems, may have hearing impairments, things like that, that can hinder their ability to participate effectively. So rather than just saying excluding people with history of mental health conditions, it's better to say that people who are not able to communicate or are not able to understand or provide consent for this study would be excluded. This is also important not to stigmatize against people who should be participating in the study, and they should not just be excluded just because they have mental health conditions. And also it's very difficult to know the history of mental health conditions in everyone. So going to the tools that you wanted to use for the study, there are different tools that you chose. So I see that you have made some changes from the submission, especially regarding the patient health questionnaire for depression. You mentioned something else in your proposal. This one is a better tool. But when you choose tools in general, it's important to see if these tools have been used locally. So tools that have been used locally in the local context in Amharic language and Afan are preferable because you have past experience using them, and they may have been culturally contextualized somehow. Even better would be using tools which are validated in our context. So when you mention tools, you'd also mention, okay, this tool has been used in Ethiopia for this research, or it has been validated in this research. And when tools go through validation process, the interpretation might also change. So the cutoff points that you use may change, for example. So it's important to review this tools that you mentioned in that context. And it's important to look at the questionnaire, each questionnaire also for the whether they are meant to be self-administered or whether they are meant to be administered by someone else. Because you say that you'll give the questionnaires for the patients, but some of the questionnaires that you mentioned are not suitable for just giving to the patients. So the way they're designed, some of the questionnaires, they are designed to be delivered by someone, and some of them are self-reported questionnaires. So I hope that you can revise this list accordingly. And for the dependent variables, you say that you are going to ask some questions, but you have to have some basis for why you want to focus on this and not use a specific tool. Especially for the dependent variable, you could use suicidal behavior questionnaire, which has been used in our context. I think in your proposal you only have a few questions, but this suicidal behavior questionnaire has more questions that can give you some context. And I want you to consider that when you ask, when you use these tools, one of the things you have to consider is the order of the tools you want to administer. So in the proposal you attached, you started with the questions on suicide. So this is going to be very shocking for patients when you start questions with suicidal questions. So it may be better to start with questions about social support, coping, depression, PTSD, and go to the suicidal questions. And I hope that you notice that some of the questions are repetitions, so you have to discuss on how to avoid those repetitions if you've already asked this in some other question. My final comment is on your referencing. So it's good to use a specific referencing style throughout the proposal. I hope that you can revise that to make it clear. So overall, I think it's a very good research proposal. The topic is very relevant, and I'm glad that you chose this topic because it's going to help us in our practice. I hope that you seriously consider some of the ethical concerns that were raised before you start your data collection. And you said that you're going to start the pretest after 2 weeks. Make sure that you have the ethical approvals before you start any form of data collection. Thank you.
Thank you very much, Dr. Azib. It was a very thorough review, not only the clinical part, also the research aspects. Thank you very much. The audience, they have been adding a lot of amazing questions. Thank you very much. I think I'll give a chance for a couple of you at the end. So I'm going to proceed with my comments. I'm not going to repeat issues that are raised by Dr. Azib. I actually agree with all of her comments. So I'm going to focus on the ones that I believe are not addressed. So since we had the main document, we were able to go through the entire proposal. And from there, what I have observed is that you lack references, adequate references in your statement of the problem and literature. Especially on the statement of the problem, you strongly claimed that sexual violence against women in Addis Ababa is a notable problem of Republicans, and a good number of them endure deep psychological misery, such as having suicidal thoughts and even attempting it. So after you made this claim, you did not put any reference throughout the statement of the problem, but you are building on this idea and mentioning that the problem is there, as if a study has been conducted and the numbers are known, and overall the magnitude of the problem, its extent is understood. If that's the case, the purpose of doing this research by itself would become like irrelevant, right? So I think in order to build a good case, you try to write something for which we do not even have a reference, because there are no good number of studies to make such kinds of claims. You try to build something that doesn't exist, and that contradicts with your very reason for conducting this research. So please go back to that and correct that, the entire statement of the problem, because it's contradicting your entire hypothesis. And on the literature review, your entire literature review, it was like many pages. By the way, it should be synthesized very well and reduced into a very meaningful subsections that are related to the objective of your research. But what you have written in the literature reviews that you were talking about sexual violence in a very lengthy way, and then the psychosocial effects of sexual violence, coping strategies among survivors. These are the things that you can write on the background to give us some perspective about sexual violence, to give some background idea about its problem, its consequences, and other things. But in the literature review, you are expected to review articles that are conducted about that are based on research questions similar with yours, so that you should try to show us whether the suicidal ideation and attempts were like high or low in other studies, what the findings were, what are the factors that led them to that kind of circumstance, and other things. But you were completely out of the objective and covering basic science about sexual violence and its consequences. So the entire literature review again has to be corrected. When we come to the objective, actually you, on the presentation on the slides, you have corrected most of the things. So now you have put them as primary and secondary outcome. So it's good to acknowledge that there are two outcomes. So you have suicidal ideation and suicidal attempt. These two things are different. These two things are different, separate outcomes. So you have to measure them separately. And as also stated by Dr. Azib, I want to emphasize that these two things are not operationalized. You just stated what they mean, how you're going to measure them, what kind of tool you're going to use, how are you going to ascertain its validity is not stated, even in the data collection tool. So you have to focus on explaining that, because at the end of the day, the outcome variable is the most important variable. Unless we can justify how it's measured, how we arrived at the classifications, it would be difficult to justify the entire research as it is. So having two outcomes will reflect on every aspect of our research, starting from the objective up to the methods. So on your objectives, please go back to the objectives. You know, a specific objective has to be smart. So each and every objective has to stand on its own. It has to be measurable on its own. So let's see the first specific objective. It says to explore the prevalence of suicidal ideation and attempts in female sexual violence survivors. So you are trying to answer two questions in one objective. So trying to determine the prevalence of suicidal ideation is one objective, and trying to determine the prevalence of suicidal attempt is another objective. So you put two objectives together as one. This should be avoided. It will automatically make it a non-smart objective. So you have to split them. You have two prevalences to measure for the ideation and the attempt. And when we come to the factors, you say that you want to identify risk factors. And on the third, you say that you want to identify protective factors. So in research, we don't write by splitting the factors like this. You just write to identify factors associated with suicidal ideation or factors associated with suicidal attempts. When you say risk factors and protective factors, it looks like, you know, when a researcher sees these objectives, what they understand is that you'll run one entire different regression analysis for the risk factors, and to identify the protective factors, you'll run a different regression analysis. You're giving that kind of impression because the objectives are separate. But these objectives should not be separate, because at the end of the day, you are looking for a significant factor that affected these outcomes. So the factors finally can be risk factors, exacerbating factors, or protecting factors, or they might not even have any association. Let's say you suspected your patient might have hyponatremia, or another person, your colleague said, maybe I think the patient might have hypernatremia, so you wanted to check. So when you send a laboratory test, are you going to write two separate orders, two separate laboratory request forms? You're not, right? You just write to measure the sodium level of the patient, and then that result can be normal, hypernatremia, or hyponatremia. So think of it like that. So when you, as an objective, when you decide to measure your patient's sodium level, you're just going to send one request, and with that request, you can get 3 different answers. In research, when you are going to assess associated factors, you're doing the same thing. You have only one objective, and you are going to do one analysis. And with that analysis, you might get risk factors, or you can get protective factors, or you might get some of the factors to have no significant association at all. So these 2 things, risk factor and protective factor, being presented separately should be avoided. And while we're on that, just like the prevalence part, the factors for suicidal ideation and attempts should be put separately as independent objectives. So you have to revise it as to identify factors associated with suicidal ideation as one objective, and as a fourth objective to identify factors associated with suicidal attempts. So you're going to have 4 different objectives: 2 prevalence, 2 significant factors, associated factors, for your 2 outcomes. That's very important. And the other minor but very important thing is that you have to use strong action verbs when you state quantitative research objectives, but you've used a word like explore, and even in the main document, there are other terms that are mainly used for qualitative research. So make sure that you're using strong action verbs to state the measurability of your specific objectives in a quantitative research. When we come to the method, again, on the main document, you just stated that you're going to use a quantitative design, which you have corrected now. You said cross-sectional, yeah, which is good. But for such sensitive topic, it's always good to add a qualitative aspect to it, because it's a very specific, very sensitive topic. People are not going to respond to your yes or no question, and they will give you everything that they feel and every aspect of their experience. Everyone's experience is different, especially if you're interested in understanding what's driving them to do that. Everyone's experience is different. So adding some part of qualitative aspect to the study will give you a much more in-depth understanding of the problem, given the nature of the topic that you're studying. So it's good to consider that. And on the population, you've said that sampling frame or units is the one-stop centers. Actually, the one-stop centers are not the sampling frame or units. Sampling unit means from like the list of the parts, the survivors, not just the one-stop centers. Otherwise, it might give the impression that you are studying the one-stop centers and not the patients. So just minor thing, work on that. On the eligibility, on the inclusion, you said that's patients, survivors who are willing to talk about their experience will be included. Actually, this is, since you have already calculated a sample size, this is an issue of giving consent or not. It's not an issue. It's not something that we priorly establish as a criteria to include or exclude participants. So you have to remove this part. It's something that we will address as an end response in our sample size calculation. And overall, your eligibility criteria, this slide by itself, it says that your research is very biased. you are planning to conduct this research in a very biased way. The first thing you said, you are not going to include minors, simply because it will complicate things. How? Because talking to the parents and other things, it doesn't have to be the parents, by the way. If the parents are here with them and asking them to give consent for their kids to involve in the study, should be fine. It should be the risk that you should be willing to take. If the parents are not here, then they will have some other guardians, legal guardians, who can consent on their behalf. So as long as you're there to study their problem, you should include them. By excluding them, you're just making your study very narrow and on a very specific population. And excluding vulnerable group of population by itself is unethical. So this is not a very good reason to exclude them, especially given that we have a year back, we have conducted 2 studies on female sexual survivors in drought-affected areas and conflict-affected areas of Ethiopia. And what we have obtained is that most of them are actually minors. So when most of the population are, these survivors are minors, you are planning on excluding them. Why? Because deep down, what I understand is that you think there is going to be a lot of hassle obtaining consent from their guardians. So this is not fair. They should be included. And this third part, participants that are fluent in Amharic, Afan Oromo, or English. I don't know what the politicians will say about this. So why? I mean, why? Is it maybe because some of your team members speak Afan Oromo and the rest of you speak Amharic and English? The research doesn't go that way. Every individual has the right to be part of a research undertaking, and they have the right to benefit from the result of the study. So if we keep excluding participants based on some unacceptable traits, we will end up having a non-generalizable result for which we can't expect for the intervention or our solution to work on everyone, because to begin with, it was not conducted on a representative sample of the general population. So, and similarly, again, if you go to these centers, from what I have seen, what you're going to get is a lot of people from the north. So you will miss out on all those survivors because you decided to only address this 3 language. So again, this is not good. Remove it. Make sure that you are going to include everyone. So about the last inclusion criteria, I have already talked about it. It's a non-response issue. Remove it. The exclusion criteria, again, participants with a history of mental health condition. Again, how are you going to ascertain that to begin with? Even if you believe that's a very justifiable reason, how are you going to ascertain that they have a mental condition that would hinder their ability to answer your questions properly, right? Are they going to have, I mean, most of them might not be even assessed for such conditions, might not be diagnosed yet, or they might have it. So you don't know that. I don't know how whether you're going to be able to access these data from their charts in the one-stop centers or not. And even if they have that, if they are on treatment, you should still give them a chance. I mean, one of the biggest problems in research is that we want to make our life easy. So if there is someone with an obvious mental health problem, you will exclude them. So when you're doing some internal medicine, surgery, pediatrics, or other non-mental health condition related study, it's good. Nobody asks that, nobody challenges that. But again, like I said, in the sense of inclusivity, it's not fair. And someone who's conducting a research on mental health is also excluding them. See how the problem is like compounding itself, especially on someone who's trying to study mental health problems. So this should be very carefully reconsidered because it doesn't reflect in a good way on your research. On the sample size, like I said, when you have 2 outcomes and when you're using a cross-sectional design, you will measure prevalence and associated factor for both. So that means you'll have 4 specific objectives. And for a cross-sectional study, the principle is that you have to calculate sample size for both the descriptive and the inferential objective. So when you do that for 2 outcomes, you are expected to calculate for sample size for all the 4 specific objectives, and then you have to pick the bigger one. you have to go through that process. You're using single population, double population formula for the prevalence and the associated factors. But the most important thing is, in this case, yes, demonstrating how you arrived at the sample size, that you have considered every objective in your sample size calculation is very important. But the question is, how many survivors are there? How many survivors will you be able to access in just 4 one-stop centers in Addis? I think, I don't know, last I checked again, you might not get these many numbers from the 4 one-stop centers. So the better thing for me, I believe, is that since it's easy to communicate with the institutions and get their number, it's better if you get their number and include it in your proposal. So that your decision to go with what kind of study design, is the quantitative alone enough, especially if you can't get enough sample size for your study, and if still you are sticking with the quantitative design, you will lose at the end because you can't answer your research question because your sample size is small. You can't get more in-depth information and enrich what you have found because you didn't add the qualitative part. So make sure to go and ask and how many people there are. So if that number is good enough, considering the non-response rate, to do quantitative research, you proceed with this. If not, have the descriptive data, and on top of that, supplement it with the qualitative design so that you can have a more comprehensive answer for your research question. So it's very important to consider that. On ethical consideration, you mentioned that you will obtain IRB approval from St. Paul Hospital only. St. Paul Hospital is a federal teaching hospital. The only thing that they can give you clearance is to conduct a study in their own institution. Otherwise, they can't give you clearance or on behalf of the other one-stop centers, because you said, I think Gandhi, Trunesh, Beijing. Can I see the study sites, please? Yeah, so yes, Dagmai Minilik, Gandhi, Trunesh, Beijing, and Abebesh Governor. All these hospitals are under the Addis Ababa Regional Health Bureau Administration, and the Addis Ababa Regional Health Bureau Administration has its own IRB. Fortunately for you, don't have to go to all the 4 institutions to get a separate IRB clearance. You can get one on behalf of all the hospitals under Addis Ababa Regional Health Bureau Administration from Addis Ababa Regional Health Bureau IRB. So after getting that, the hospitals will give you just permission to proceed to do the study. So St. Paul will give you the permission as a student researcher to proceed with your research. So you take that clearance and you will take it to Addis Ababa Regional Health Bureau, and their IRB will approve and give you the clearance. So make sure that you correct it that way. And on the informed consent, on the main document, you did not write whether it was verbal or written, but you said written. So for a very sensitive study, people might not feel comfortable giving consent, any written confirmation for their participation. It might be an issue, so I think reconsidering it or justifying it as a very sensitive topic and going with the verbal is also one of the acceptable scenarios for your research. So because I know that for a fact that some people might say no in such scenarios when you ask them to give their written permission. So just reconsider that. And on the data management and analysis part, what I can simply say is that it's very shallow. You have tried to just frame some things. You said some descriptive analysis will be done on the data analysis part. The next slide. Yeah, the next slide. So you just said that you do some percentage frequency and logistic regression. By the way, it's like whenever you plan your data analysis method, think of it as like you are writing an order for your patient. So you just don't order a medication without specifying the dose, the frequency, the mode of administration, and whether the patient should be controlled for something while the patient is on that drug and other things, right? So you have to make sure that you have exhausted everything So when you pick the model, logistic regression is a very broad model. There are different types of models. Which regression, logistic regression model, how are you going to use that? How are you going to assess whether the logistic regression model is fit for your data or not? All these things has to be clearly stated. So I think those are the things that you can go through. And on the annex, informed consent form is not attached at all. That's the very important part of your research, especially for study with this level of sensitivity. And the tool, you mentioned that you're going to ask them in Amharic, Afan Oromo, and English. At least you should add the Afan Oromo, even to begin with. But other than that, you have to make sure that your tools are translated into all the local language which your study participants use to communicate at the time of the data collection, or you can even get that information ahead of time. So these are some of the comments that I have. And for the rest, I think I just dived into the comments, considering that you are a medical student. I mean, going through all of these details and trying to rewrite it in less than a week after you communicated with us, and the fact that you are willing to present here, considering how much time can be a constraint on your site, and the fact that you're willing to receive constructive comments says a lot about you and your team. I'm proud of you, and congratulations for reaching this far as junior researchers. I'm sure you'll make a very fine researcher in the future. Thank you very much. These are my comments. I would like to give Dr. Azib, if you have anything to add, you can add, but I'd like to give the opportunity for the audience. If there's anyone who'd like to ask, please raise your hand. In the meantime, if Dr. Azib, if you have anything to add, if anything comes up to your mind, you can add.
Okay, thank you. I agree regarding the initiative that was taken by the students. I want to appreciate that. I've added a few more comments on the chat box, just to correct a few things. Just on terminology, PTSD refers to a disorder, not a disease. Operational definition for suicidal ideation, I think you included self-harm, but self-harm is a different concept unless you want to assess both self-harm and suicidal behavior. So those might be two different things. And finally, if you decide to use the same tools that you have mentioned, please review the translations. There are significant errors in translation. For example, in the assessment on PTSD, አንድ ጥያቄ ከመጠን በላይ ንቁ መሆን ጥያቄ ያለ ነው። It's supposed to refer to hypervigilance, but hypervigilance is not ከመጠን በላይ ንቁ መሆን. This is just an example. So there are errors in the translation which would skew the result of your study. But as many said in the chat box, I hope that you strongly consider qualitative study to achieve your objectives. Those are my additional comments.
Thank you very much. I think I was going through the comments that are posted on the chat box. I think most of them are addressed. Zacharias, he wrote that Abebesh Govena is not a health center. It's a MCH hospital. Yes, by the way, writing names consistently, it's very important. In these presentations, we normally tend to focus on the major things, but these things are really important because you know, when you are like publishing your research, people would like to know which hospitals you have conducted the study, and unless we're using the proper names, we're miscommunicating in the research world. It's not fair for the hospitals, for the system, and other researchers in other parts of the world might think that we're conducting the study in a different institution. They might know Abebesh Govena as a hospital, but when you say health center, okay, maybe there is a health center. So not to give that kind of impression, make sure that you always write your study areas properly, including their abbreviations and everything. So is there anybody who'd like to add? Okay, David, by the way, we just asked you questions and we did not expect you to reflect, right? So the point of this session is for you to take some lesson from it and revise your proposal accordingly. But we'd like to give you a chance to reflect on what was said. If there are some things that you'd like to reflect back, you can also do that. Over to you.
Okay, thank you, Dr. Qudust and Dr. Azeb, for those constructing criticisms. We really appreciate having this kind of criticisms at this very this early age of the proposal, because it will help us when we conduct research to avoid any kind of major mistakes. So I would like to thank both Dr. Qudust and Dr. Azeb, and also I would like to apologize for any kind of mistake we made. It's not because of negligence, but because of inexperience. So thank you.
Thank you very much, David. Like you said, I don't know what personally, I didn't know how to write such type of proposal when I was a C2 medical student, honestly. That's why I said I was not just trying to make it feel better. Actually, you guys are doing a great job, especially considering the fact that you have revised it within a very short time without even us insisting you to revise it. So it shows a lot of effort, commitment, and understanding on your side. And thank you very much for your presentation. And Dr. Azib, thank you very much for dedicating your time and for sharing your valuable comments with David and the audience, with all of us. Thank you very much. The audience, thank you everyone. I think there's a post test. Yeah, the link is already posted. The audience can attend the post test. The session will remain open for you to attend that. Thank you very much. Have a great night.